Good evening, everyone. We know that heart conditions remain one of the leading pressing health concerns in India and as well as across the globe. Yet people use the term heart attack, heart failure, and cardiac arrest interchangeably. While it is true that each of them signifies a health crisis involving the heart, they aren't the same and each of them has radically different conditions and treatments. So, understanding the difference is imperative as early detection and the right response can save life. So, what truly sets them apart? The answer lies here. The heart attack occurs when a blood flow to the part of the heart is blocked. Heart failure is a chronic condition where the heart weakens and cannot pump the blood efficiently. Whereas cardiac arrest, on the other hand, is an electrical malfunctioning that causes the heart to stop beating suddenly. Each carries a unique risk, symptoms, and urgencies that demand awareness. Therefore, in this session, we will break down the differences between these three conditions, exploring how to recognize the early signs and timely signs, and highlighting the importance of immediate action and preventive cares. We are honored to have Dr. J. Ramakrishna with us today. Dr. Ramakrishna is a distinguished consultant interventional cardiologist at Apollo Hospital, Jubilee Hills, Hyderabad, with extensive expertise in managing complex cardiovascular conditions. Known for his precision in interventional procedure and his compassionate, patient-focused care, he has earned a strong reputation in the field of cardiology. Over the years, Dr. Ramakrishna has been at the forefront of treating coronary artery diseases, heart failure, and structural heart disorders, combining clinical excellence with a deep commitment to improving patient outcomes. His work reflects not only technical mastery but also the dedication to spreading awareness about preventing heart health. So, in today's session, he will be helping us differentiate between the heart attack, heart failure, and cardiac arrest, also clarifying some common misconceptions and guiding us towards timely recognition and interventions. So, before going further, Doctor, would you like to add something from your end?
Yeah, hello everyone. I'm Dr. Ramakrishna, consultant cardiologist from Apollo Health City, Hyderabad. So it's a very common question we face, like what is heart attack, what is heart failure. So heart attack is something like the heart is not getting enough blood supply. So heart has predominantly three blood vessels. So is there any narrowing inside the blood vessel, or sometimes that blood vessel got completely occluded? That lead to chest pain. That is the time we call it as a heart attack. So if you have chest pain and breathing problem, that is mostly heart attack. That is because of the heart not getting enough blood supply, maybe due to some clot formation. That is the most common reason. Now, coming to heart failure, the heart is not pumping. The heart has to pump the entire body. There is a central motor of your body. If there is any weakness of the heart, that may be predominantly in our country, the main reason is because of heart attack, and many don't recognize it on time, and they develop weakness of heart muscle. Not only that, due to various reasons, sometimes maybe due to viral fever, sometimes maybe due to after pregnancy, after all excessive alcohol consumption, this can lead to heart muscle weakness. So that lead to heart failure. Heart is not able to pump to the body. So coming to the last term, that is the cardiac arrest.
Yes.
Cardiac arrest. What is cardiac arrest? Means heart has stopped functioning. That is the ultimate stage. That is end stage of any heart disease or any illness. That is the ultimate event. That is cardiac arrest means heart stop beating. That may be predominantly most of the times it is due to heart attack. So sometimes what happens is after heart attack, heart is not getting any enough blood supply, and that lead to heart beats in a irregular fashion for some time, and after that it stops beating. So that is the stage we call it as a cardiac arrest.
Thank you so much, Doctor, for this clearing the difference between them. Doctor, my next question is why do these three conditions often get confused with one another? Because people usually don't understand these three terminologies separately.
Yeah, it's something like medical terminology. It's difficult for common public to understand the subtle difference between the two. So heart failure is like a chronic condition, or it may be it's usually acute along with the heart attack, but because all three can be in the same spectrum of the disease. Suppose if a person develops heart attack, he feel breathlessness, that stage we call it as heart failure. and at this end his heart stops beating. That is called cardiac arrest. So all of them are in the same spectrum of the disease.
Okay. So, doctor, what are the early warning signs of heart attack which are compared to heart failure or cardiac arrest? Can you please tell us?
Yeah, heart attack is their acute stage. It is an emergency stage. So suppose if you are any person developing any breathing problem or chest tightness, especially on the left side, or if you feel some throat discomfort while walking or climbing stairs, so that is the stage we call it as a chronic stable angina. Angina means the chest pain. Your body is giving you indication that something is not good with your heart. So there is some decrease of blood supply. At this stage patient experience exertional breathlessness or some chest pain while walking, climbing stairs, or burning sensation, or sometimes they feel heaviness on the chest and along with the left hand pain. So these are the subtle signs our body gives indication. Many of the times, 90% of the times our body gives indication. So we fail to identify that, and many patients think that this has a gas, and they keep on consuming pantacid and and other homemade remedies, and they come very late to the hospital. So because they come very late to the hospital, for a long time heart is not getting enough blood supply. The heart muscle becomes weak, so heart muscle becomes damaged, and it may not recover permanently. Because of that, they may land in heart failure in the later stage if they survive. So sometimes after heart attack, because of this lack of blood supply, heart if you try to hurry in that situation, and heart beats in a irregular fashion, and patient collapses on the way to hospital sometimes. Or sometimes in the middle of the night, and he had some chest discomfort, he didn't bother about it, and he had a heart attack, and he died during the sleep. So these are all like something like cardiac arrest, or something like irregular heartbeat appearing in the middle of the night. Unless we attach some ECG or some smart devices, we don't know what happened to many of these patients.
Okay, so this is how a person who has a heart attack later develop heart failure, right?
Yes. So heart failure typically they present with exertional breathlessness. They feel breathless while walking, climbing stairs, and they develop some leg swelling, that is, or sometimes facial puffiness, or swelling in the evening times. Sometimes this subtle sign of heart failure.
Okay. So, doctor, my next question is like, in a case of cardiac arrest, what immediate steps should a bystander take before medical help arrives?
Yes, first thing that is very important. That's why everyone needs to know basic cardiopulmonary resuscitation. They should do some chest compression by the time ambulance or some other help arrives at that situation. So that will save. Actually happens some you may be somewhere in a shopping mall, railway station, wherever maybe. So if you start compressing on the left side of the chest like this, and if you put your pressure, just manually you are helping your heart to pump the blood to the brain. So brain is very sensitive organ for in our body, because in if your brain doesn't get blood supply for 20-30 minutes, it becomes irreversibly damaged. So by doing the chest compression, you are maintaining your brain circulation, so that there is a increased chances of survival for that person, uh, when compared to no CPR at all. And sometimes what happens is that person may be having irregular heartbeat at the time, and after doing some CPR, that irregular heartbeat may disappear, and heart starts recovering. So these are the advantages of CPR. So any bystander, if he knows basics of CPR, or if they are interested to learn, there are many ways to learn. No, so many videos are there, and so many education channels are there, and they can come to any hospital to have a basic CPR course.
Okay. Thank you so much, doctor. So, if we see from the lifestyle modification factor or from the approach, so how can lifestyle factors like it could be diet, exercise, and also stress management can reduce the risk of these heart conditions?
So very important question. The diet lifestyle is very important nowadays. We are seeing so many young patients are coming with heart attacks. So many 20s, 30s. Majority of them have some or other bad habits like smoking, and nowadays many people are coming after taking drugs. with chest discomfort. These are all very, very high risk factors. So apart from that, excessive alcohol consumption, and the other important unmeasurable thing is stress. Many of them don't have proper sleep and unhealthy eating habits, and they will keep on eating in the middle of the night, and irregular dietary styles. So that, and there is no exercise of time for them because of their improper schedules. So that is leading to the early heart attack, especially in our country. So we are seeing a lot of youngsters coming with heart attacks.
Yes, doctor. Correctly said. So, if the genetics come into the frame, so what role does family history or genetics play in increasing the risk of heart attack, heart failure, or might be cardiac arrest?
Yeah. So genetics is one important thing because by Asian race itself is at increased risk of heart attack when compared to the white population. So among Asians, South Asians like India and China, we are maximum number of heart attacks in the world. So why? So we are genetically predisposed to this sort of heart attack. And apart from that, if any person had a family history of heart attack, like uh, developing a heart attack in a male below 50 years or female below 40, female below 50, male below 40, so that is highly suggestive of some genetic component for their heart attacks. So they might be having a some form of cholesterol abnormality. That is the most common reason for heart attack. Their cholesterol levels are abnormally high, so that is leading to high cholesterol levels keeps on accumulating inside the heart blood vessels, and that can lead to heart attacks.
Okay, thank you so much,
So if a
doctor.
person had a family history of heart attack, it is very,
Yes.
very important for them to have a check, at least lipid profile, their cholesterol levels and sugars, at least they should be evaluated before they
Okay.
develop any complication.
Okay. So, apart from the family history or the genetics, for a regular person or normal person, what regular screening or checkups would you recommend for someone at a higher risk of developing these conditions?
Yes, everybody after 30 years, or if they have family history after 20 years, they should have at least once in 2 years, they should have basic profile like sugar, cholesterol, hemoglobin, liver function test, kidney. All these tests should be done at least once in 2 years. So if everything is normal, then you can check after 3 years or 4 years.
Okay.
Why it is important is because this cholesterol plaques starts depositing as early as 2 years in our body. So if their cholesterol levels are very high, so they should be on medication before they develop any complications.
Yes.
And
So,
obesity is another important reason for our country because 30% of the school children are obese in our country. We focus more and more on education and less of physical activity and diet.
yes, correctly said, doctor. I guess after COVID, this also get reduced. The physical activities in the schools also it get reduced, correct?
Yes.
Thank you so much, doctor. So these were the questions all I have for you. Lastly, do you have any message or advice you want to give for audience?
Yes, everybody should have a regular protocol for their exercise, at least 1 hour of walking every day, and they should be away from the smoking and excessive alcohol consumption, and try to have a healthy lifestyle with healthy diet. Eat more and fruits and vegetable based diet, less of red meat. So, and if they have any family history, they should have the regular checkup and try to stop smoking if you are already doing, or don't start at all. That is the most important thing.
Yes. So we wrap up today's knowledge pack session on differentiating heart attack, heart failure, and cardiac arrest. Our sincere gratitude goes to Dr. J. Ramakrishna for breaking down these critical conditions with such clarity. His guidance has helped us to understand how each differs, why timely recognition matters, and most importantly, how awareness can be life saving. To our wonderful audience, thank you for being with us. We hope today's discussion motivates you to take proactive steps, whether it's the simple learning, the warning signs, or scheduling your regular checkups and adopting some heart healthy habits. Also, stay tuned for more such informative sessions with leading experts. Until then, prioritize your heart health, stay informed, and don't forget to follow us on social media for trust health insights and tips. Dr. Ramakrishna, once again, thank you so much for joining with us and sharing this practical knowledge.
Thank you. Thank you.